Welcome back, guys. It's lesson 8 on the endocrine system, and what we're looking at today is being able to describe the functions of the endocrine system, also identifying the major glands in the endocrine system, and being able to explain the function of hormones, including growth hormone and also the thyroid hormone. So, during the last couple of sessions, we've been looking at the nervous system, and not sure if you remember, but right back at the start of our presentation on the nervous system, we spoke about saying the nervous system and the endocrine system were very closely related. But just to reaffirm that, and just so you know, and the question here is, what are the differences between them? So, both of them send messages around the body. However, the nervous system, which we've just been looking at, uses the electronic pulses, alright? And that's the way it sends its messages around the body through the neurons, through electronic pulses. Endocrine system is different, and it sends its message through essentially chemical messages and through the release of different hormones into the body. And that's the way it communicates. And in our body, I'm sure you'll all be aware of some of these already, but we have all of these different glands that are capable of releasing different hormones into the body. So have a look right at the top near the brain. We've got things like the pineal gland, the hypothalamus, the pituitary gland. We've got, coming further down the body, the thyroid, the thymus. We've got the pancreas. We've got the adrenal glands just there. We've also got the testes, and we also have ovaries as well. So be aware of where all these glands are, but we're going to look more specifically at what some of them do across the next couple of presentations actually. And essentially, we're also going to look at the chemicals that they release and what those chemicals cause our body to do. And the first one I want to look at is growth hormone, okay? And growth hormone release is stimulated essentially from the hypothalamus, which is, if we go back, up here, situated in the brain. That's where growth hormone comes from, and secreted from the anterior pituitary gland. Alright, so it's stimulated from the hypothalamus, and the actual chemical itself is secreted from the anterior pituitary gland. Its primary function is to stimulate growth in children and adolescents, and as we get older, we start to produce less growth hormone, okay? That's how it works. When we're younger, it's released quite a lot to help us and to tell our bodies that we need to grow, we need to get bigger, and we need to get stronger. But as we get older, release of that hormone begins to slow down. Its production peaks every 3 to 5 hours. We'll have a peak in production of growth hormone, and it's triggered by when we go to sleep. So that's why it's important for children to get lots of rest, because various reasons, but one of them being when they go to sleep, that's when growth hormone is going to be secreted more. And you know, the more rest you get, the more growth hormone will be secreted, the bigger and stronger. You know, there's a lot of factors in that, but in theory, the bigger and stronger you'll grow, the more rest you get. Can also be triggered by stress or by having particularly low blood glucose. And when we look at the role of human growth hormone with adults, it plays an important role in post-exercise recovery. So, you know, if you imagine you've got a client or even a runner or someone who's doing a lot of intense physical activity, they're going to need this growth hormone to help them recover, to help them to grow back stronger, and to see the benefits of their training. And leading on from this, what we find is that growth hormone can be used as a drug, and in particularly in sort of bodybuilding, power type sports, you'll find that growth hormone has been, not for me to speculate, but could definitely be used as a drug or a way of it increasing sports performance. And if you are taking it as a drug, or if you're aware of someone is, or just so you know the effects, you could be having nerve damage, muscle damage, joint pain, there's an increased risk of diabetes, even cancer, and cardiovascular disease. But that's the role of growth hormone, and that's where it comes from. We also have thyroid hormones. So we have thyroxine, which is a pro-hormone produced and secreted by the thyroid gland and converted to its active form, which is triiodopherine, and that's in organs such as the liver and kidneys. And there's a smaller amount of the body's triiodopherine is secreted directly from the thyroid gland. So, just to recap on that one, all right? Thyroxine is the prohormone, and it's produced and secreted by the thyroid gland and converted into its active form, triiodopherine, in organs such as the liver and kidneys. And there's a small amount is secreted directly from the thyroid gland. So small amount comes from the thyroid gland. The rest is secreted as thyroxine, and it's converted in the liver and kidneys into its form, where it can be used by the body. And the primary role of thyroid hormones is to regulate metabolic rate. So by now you should all know what we mean by metabolism, and you know this hormone regulates our metabolism. You've probably heard someone say that they've got an inactive thyroid or an overactive thyroid. Inactive, that's when we're not releasing enough, and we could potentially get people who are overweight or obese because there's not enough thyroxine in the body. However, you could also get the opposite to that as well. Other functions, things like brain development, muscle control, digestion, and also bone maintenance. And a diet supplying sufficient iodine is necessary for adequate thyroid hormone production. So, you know, doctors may prescribe iodine tablets, or you could look as a PT as recommending an increased amount of iodine in the diet. And then we also iodine is primarily obtained from fruit and vegetables. So getting in those fruit and veggies, definitely good for thyroid function. All right. We also have something called hyperthyroidism, brackets, Graves' disease. This can lead to something called thyrotoxicis, with symptoms relevant to exercise safety, including weight loss, heat intolerance, palpitations, arrhythmia, tiredness, and tremor. And hypothyroidism can result from an autoimmune attack. And symptoms of it are things like getting tired really easily, getting cold all the time, gaining weight easily, getting depressed, muscle stiffness, and really what we're looking at there is quite a range of real complex issues, to be honest. You know, and that would be something that I'd suggest that you need a doctor to support you with. If you suspect that someone has got hyperthyroidism, so, you know, hyper meaning overactive, you know, it probably is something that a doctor's going to have to look at. You may be able to describe it as a PT. You may, you know, you could have an awareness of it that you're going to take into account when you do your programming, but it's not for us to try and solve that problem for the client. Okay, we also have parathyroid hormone, and this is secreted from the 4 parathyroid glands at the back of the thyroid gland. And its primary function is to regulate calcium levels in the blood. And there you go, there's a diagram there of the parathyroid glands. You can see there are 1, 2, 3, and 4. Typically, it increases calcium levels by acting on the kidneys, bones, and intestine. It's released with changing blood calcium and magnesium levels. Diets chronically low in calcium can increase osteoporosis risk. So we already know that from when we looked at the bones. But this gland here, okay, this thyroid gland, will make sure that we are regulating, that we have enough calcium in our blood. So, let's hope it's a quick, real blast through those. We looked at growth hormone, we've looked at the thyroid hormones as well. So go back, revise those, make sure you know what they are, and you'll be all set for the exam at level 3. Got another presentation next on the rest of the endocrine system, so hopefully I'll see you there.